Hi, today I am with Dr. Samantha Pfeifer, who is a reproductive medicine specialist from Weill Cornell Fertility Center in New York City. Welcome.
Thank you so much for having me. It's so good to see you.
You too. And we've done lots of interviews before in the past, haven't we, where we've focused on a particular area of fertility. Today, we're going to do fertility facts versus fiction. Readers have sent in questions that have been the top of their mind, and so Dr. Samantha Pfeifer is kindly going to answer those and say whether they're true or false. There may be some that you want to elaborate on, and there may be others that don't need it. Myth or not? Being overweight contributes to IVF failing.
That's probably false. However, in all, it's really, you can't say that being overweight prevents people getting pregnant. I think, however, people who are very overweight, there may be a higher requirement for medications with IVF. There sometimes can be difficulty in getting the eggs, technically, just because of the issues with someone who may be obese. And so there may be a reason for some individuals to lose weight before doing IVF. Also for safety factors with anesthesia and things like that. But I think as a blanket statement, being overweight reduces your success. I'd have to say kind of no with those caveats. It's mostly false, yeah. I mean, it's a controversial area. And I think for people who are very overweight or obese, sometimes reducing weight by a small amount can actually improve things.
What about being underweight contributing to fertility treatment not working?
Underweight is a little easier to treat in that people who are very underweight may have difficulty responding to the medications. Underweight with a BMI of 17, 18 doesn't necessarily make things difficult. But what I think about in people who are very underweight is there some reason why they are underweight? Many individuals who are very underweight may have an underlying eating disorder or have had a history of an eating disorder. And in those individuals, sometimes pregnancy and the weight gain and the body changes during pregnancy can be difficult. So I worry about that aspect of it. Individuals who have a very low weight because they have a medical condition that prevents them from absorbing nutrition, that can be a potential problem. We can handle a lot of people who are very underweight.
The next one is quite particular. Asians believe that pineapples are to be avoided when trying to conceive. True or false?
I have no idea. I think that there's a lot of Asian wisdom, and these things don't just appear. So there's probably an element of truth in that. But frankly, I have no idea.
Although pineapples are supposed to be the symbol of fertility.
There we go.
And
yes.
I drank a ton of pineapple juice whilst I was having treatment on the off chance that it might help. And having spoken to many fertility nutritionists since, there's no data to prove that that is the case.
Well, they taste good. I mean, pineapple is quite delicious. It's better than having something that's quite revolting.
Mm-hmm. Yeah.
You have to eat something revolting to help you. So I really have no idea. I just thought that was a very cute question. And I apologize, but I have no idea.
Did you know that also in the trying to conceive community, the other big food that people tend to go for after a transfer is going to McDonald's to have salty fries? Salty
fries can really make you feel better almost all the time. That's kind of my go-to food. 2 a.m, you've had a bad day or something. And we all in college used to invariably go for salty fries at 2 a.m. It would console many people that were upset or stressed. So I don't know if there's any truth to that, but I can certainly understand that would be an appealing thing to do.
I think it's a publicity stunt from McDonald's to get more people to go and eat their chips, maybe.
Well, there's probably a little element of truth in it. Fried, salty food that has some crunch to it is usually quite delicious. So I can understand that. But again, I don't think there's any truth to that at all.
A woman having an orgasm during sex helps with fertilization as it transports sperm better. True or false?
Oh, there's no truth to that. And I think the problem is that most women in general do not have an orgasm at the time of ejaculation. That doesn't happen all the time. And there's no data to suggest that it's necessary for pregnancy. So I think for many cases that can often tend to make people feel bad. And there's no
Well, I think
proof.
it piles on the pressure, doesn't it, really?
It does. It really does. Yeah, absolutely.
And then the next one is elevating your legs after sex makes conception more likely. True or false?
Oh, that's terribly false. That's terribly false. These are the things that sort of, the old-fashioned things that people told you. It helps tremendously. I think that a lot of these, wives' tales, if you will, happened because we really didn't understand fertilization or anything. The sperm swim for a reason, and they can swim where they need to go, and they're there within 5 minutes. So sitting there with everything elevated, your legs elevated, is just kind of gymnastic torture. One of the funny things that we used to do with IVF, it's funny now, but in women with a retroverted uterus, it was felt that it was very important that they would have their embryo transfer instead of in a normal position with your lying on your back with your legs off to the side. They had to be on their face with their butt up in the air in a knee chest position if their uterus was tilted backward, because that was felt to correct the position of the uterus for transfer. And then it was realized that really didn't make any difference at all. So, there's sort of, looking back, kind of funny things that happen with good intentions, but really no scientific basis. So that's a false.
No sex after transfer during the 2-week wait, the 2WW.
The 2WW, which I didn't know what that was the first time you told me about that. I don't think there are any data for that. I think that, we always say in America, don't change a winning game. Things are working, just don't do anything to disturb anything. Part of that is also, if you don't get pregnant, women tend to find a way to blame themselves about anything they had any control over during that time that maybe caused the whole cycle to fail. So just for the fact that you don't want to have to blame yourself about doing something. And, frankly, sex, if you're trying to get pregnant, sort of loses its allure a little bit. And if anyone really feels like they want to have sex, that should sort of be celebrated, because sometimes it can be so stressful and so tied to getting pregnant that, it would be nice to do that. So in a way, it's like a good thing. But I think just to avoid having something to blame yourself about in the event the cycle is not successful, it probably is better not to.
Viagra for men impacts sperm quality when trying to conceive?
No, it just helps sperm come out. And actually, the more frequently you ejaculate, the better the sperm quality, because we know that if sperm is resting there for a long time, that the quality, the sperm DNA may denature somewhat. You get DNA fragmentation. So frequent ejaculation is actually better for sperm. So the more frequently you ejaculate leading up to the day of ovulation or day of IVF retrieval probably has a positive impact on sperm quality.
Cat hair is bad for fertility?
Cat hair is bad for a lot of things, but I don't think it's bad for fertility. Yeah. Toxoplasmosis is bad. You don't want to get toxoplasmosis, which is a disease that's transmitted in cat feces. But I don't think cat hair has ever been shown to be bad.
Keeping feet warm helps fertility?
Keeping feet warm is a nice thing, but I don't think it has any bearing on fertility. No, I mean, having foot massages and nice warm feet that are being massaged, those are nice things that may help. But honestly, I've never heard that before.
And also reflexology is very nice if people want to relax.
Yes, I mean, these things are very good for your mental and physical well-being.
Swimming in the sea can affect your eggs or your sperm due to it being cold?
No, I think that your eggs don't get cold unless your body temperature drops down significantly, but your body temperature is not going to drop down significantly by swimming in the ocean unless the ocean is really cold, and then you get really cold. But no, I mean, can it affect testicular? I mean, the testes are outside the body for a reason. You don't want them too hot or too cold. But I don't think, swimming on a daily basis outside, I don't think that would have any impact.
Higher chances of getting pregnant after a Hycosi procedure.
Possibly true. There are data that doing a hysterosalpingogram with oil-based liquid, has been associated with an increase in pregnancy rates afterwards. But we typically use a water-based dye for hysterosalpingograms. There hasn't been an association, but the theory is that maybe it flushes out the tubes, cleans out the cobwebs, if you will, and there may be an increase in pregnancy rates after some procedure where fluid is pushed through the uterus and out through the fallopian tubes. So that's a maybe.
Freezing eggs or embryos at 40 is worth it. True or false?
Freezing eggs or embryos at any age gives you options you otherwise wouldn't have. So in that sense, it's true. But I think that it's ideal to freeze eggs in the early to mid 30s. The quality of the eggs is not quite as good at 40. And it also depends on how many eggs are being frozen. I mean, if an individual has a very large ovarian reserve and is freezing, say, 15 or 20 eggs, then that can be very beneficial. If an individual is freezing 1 or 2, the success rates may not be quite as good. But again, those are a couple eggs that you have that you wouldn't have had otherwise. So I think it's one of these, you need to talk to your care provider and see what are the pluses and minuses for a particular person to determine if that is helpful for that particular individual.
You can only freeze on day 5. Is that true or false?
That is false. Nowadays, a lot of programs are moving to day 5/day 6 transfers. If you freeze on day 5 or 6 or even day 7 after retrieval, then that's all possible. And that is a blastocyst stage embryo. And that certainly, they survive well at that stage. It's also, if you have embryos that make it to blastocyst by day 5, 6, or in some programs they freeze on day 7, then those embryos are good quality because they've made it that far. But certainly you can freeze embryos the day after fertilization. You can freeze embryos on day 3.
Day 6 blastocyst can result in a pregnancy. True or false?
Absolutely, yes. I mean, day 5 and 6 are really very good days to have embryos from. We always think day 5 is better because it made it there faster. But day 6 pregnancy rates are great, and I would not sneer at an embryo from day 6 at all. Embryos on day 6 are wonderful, pretty much equally good as day 5.
Following a miscarriage, you're more fertile.
I've heard that a lot. I don't know if that's necessarily true. I think there are data that say that a biochemical pregnancy in IVF increases your likelihood of being pregnant. I think if you have a pregnancy at all, then it tells you that sperm and egg like each other. It tells you that implantation happened. It's always unfortunate the pregnancy didn't progress, but it kind of gives you information you otherwise didn't have, because we always wonder if there's no implantation, is implantation a problem or was it just that embryo? So I think anyone who has been pregnant, it does give you some positive feedback about likelihood of implantation. I find it emotionally, there's a lot of encouragement from that. Despite the fact it's a negative test result ultimately, which is really difficult.
Bending during early pregnancy is harmful. True or false?
That one I found was quite funny. No, it's fine. I don't know how that came about. We don't encourage people to jump up and down and do very aggressive physical activity. I always think of the embryo in early pregnancy as like a very delicate basket of eggs. You don't want to jostle it. Mm-hmm. But bending really has no impact at all.
This will make you laugh. Well, after one of the transfers I had, having seen you in New York, I flew home from JFK and said to the people at the airport, I can't lift my bags. And they put me in a wheelchair.
I think that's perfectly reasonable. I don't think you should have to lift anything.
The shape and position of a pregnancy bump can show you the gender.
That's a very, very strong wives' tale. But no, I mean, you got to think about it. You've got a 50-50 chance of being correct.
Yeah. Exactly.
So it's kind of, So no.
You're more fertile when you're breastfeeding, true or false?
That's interesting. Probably not. No, I think that for many women, when they're breastfeeding, their period is gone, has disappeared. And so they're actually not menstruating or ovulating. Because of that, there's a lot of vaginal dryness and sex can be actually quite uncomfortable. Can't think of a reason why people would be more fertile when they're breastfeeding, except the fact that you've had a successful pregnancy. So are you more likely to have another one? And just the knowledge that, hey, I did it once before can be very positive reinforcement for, I think I can do it again. This is possible. Because if people have struggled with fertility for a long time, it doesn't seem like it's ever going to happen, and it can be very distressful. So I think having had a successful pregnancy, at least you're like, hey, I did it once, this is possible, when in fact that may be the first acknowledgement that it really is possible. So I would put it in that category.
You can get pregnant with a second child faster than the first, true or false?
No. Secondary infertility is relatively common. It's funny because there's been a lot of interest in, do people get pregnant faster if they do IVF? Individuals who may have used a surrogate for a pregnancy and all of a sudden find themselves pregnant, or couples who adopt a baby and all of a sudden they find themselves pregnant. I mean, those things occur, but they're not statistically significant. So we hear about the ones it happens to, we don't hear about the ones that it doesn't happen to. So I think that is false.
Last one. After
Yep.
40, natural pregnancy isn't possible because eggs are too old.
No, that's not true either. I think that after 40, it's more challenging and more difficult to get pregnant, but people do get pregnant. Some people get pregnant relatively easily. Some people struggle terribly after 40. The eggs are old, but I think we have to recognize that when we say the eggs, they're not as good quality at 40, it doesn't mean that they're all bad or they're all half bad. What it means is that a higher percentage are bad, but the ones that are good are still good. So there's still some good eggs there. So it is possible after 40 to get pregnant.
Thank you so much for doing that
You're
true and
welcome.
false fertility facts versus fiction with me today.